Hi, my name is Julie Emerson, and I'm doing my presentation on the community nursing practice model. The community nursing practice model serves as a framework for a transdisciplinary practice of nursing and social work. The diverse and complex practice takes place in school-based community wellness centers, serving children and families from multicultural communities. The collaborative approach of the CNPM encourages relationships between local communities and healthcare providers and fosters an acceptance of each as an essential component to the healthcare system. Marilyn E. Parker and Charlotte D. Berry are co-creators of this program. The CNPM was co-created by nursing theorists Marilyn E. Parker and Charlotte D. Berry. Dr. Parker is a professor at the Christine E. Lynn College of Nursing at Florida Atlantic University. She was awarded the 2001 Fulbright Scholar Award to Thailand, where she continues to communicate and collaborate with her Thai colleagues. Dr. Parker is a fellow at the National Public Health Leadership Institute and the American Academy of Nursing. She is recognized as a distinguished practitioner in the National Academies of Practice in Nursing for her contributions to the discipline. Dr. Parker is committed to caring for underserved populations and developing research and policy to promote community well-being. Her mission is to improve nursing practice and education through the development and implementation of nursing theory, using both innovative and traditional means to improve care and advance the discipline. Dr. Berry is also a professor and master teacher at the Florida Atlantic University Christine E. Lynn College of Nursing. She is nationally certified in school nursing and an American Academy of Nursing Fellow. In 2013, Dr. Berry was named one of the best 25 nursing professors in Florida. The focus of Dr. Berry's career has been to care for people in schools and communities. Dr. Berry continues to conduct research to determine the global usefulness of the community nursing practice model in rural communities in the United States, Uganda, and Haiti. The theoretical proposition of the CNPM states, nursing is nurturing the wholeness of persons and environments in caring. Dr. Parker and Dr. Berry strive to fulfill this proposition through improving nursing education, thus enhancing the care given to all people and implementing community healthcare systems with a special focus on transitional care. The CNPM serves to bridge the gap between persons living in underserved communities and the more substantial healthcare system. The major assumptions of the CNPM include essential and actualizing values. The three essential values are present in every nursing situation. They include the assumptions that persons are respected, persons are caring, and caring is understood as the essence of nursing, and persons are whole and always connected with one another in families and communities. The actualizing values are present only in certain situations where they are needed. These values include access, essentiality, community participation, empowerment, and intersectoral collaboration. The essential and actualizing values of the CNPM are encompassed in four interrelated themes: nursing, person, community, and environment. The structure of the CNPM allows nurses to respond to unique calls for nursing and encourages other community partners to create programs that also nurture well-being. The structure of the CNPM allows nurses to respond to unique calls for nursing and encourages other community partners to create programs that nurture well-being. The CNPM is represented by the concentric circles of empathetic concern. This model is depicted as three concentric circles around a core. The core and the concentric circles of service are all interconnected, with the nurse reaching out through the concentric circles to strengthen and widen the web of relationships with colleagues, clients, and community members. I have included an image of the concentric circles of empathetic concern. The core services are the heart of the CNPM. This is where all the call for nursing is identified. It includes services provided to children, students, school staff, and families from the community. Nurses listen to clients' stories of desire for health and well-being. They respect the self-care practices of clients and honor indigenous care techniques of the community members. The nurses prioritize the healthcare needs, providing culturally competent care that supports caring for self, family, and community, and collaborating with others for holistic care. The first circle includes persons and/or groups who share a desire to care for individuals receiving services at the school-based wellness centers. Activities taking place in this circle include community building activities, health, education, and in-services, serving on school committees, reviewing policies and procedures, and conducting community assessments. The second circle includes structured and organized groups who share concern about well-being of a community in the district or county level. For example, school districts, public health departments, and the Red Cross. Activities in the second circle consist of policy appraisal, development, and evaluation, leading committees responsible for overseeing the care of students and families, providing school nurse education, assessing school health services, and describing research findings for best practices related to school and community health issues. The third circle includes state, regional, national, and international organizations whose focus is on improving the well-being of underserved communities. Activities in the third circle include collaboration about scholarship, policy, outcomes, practice, research, and education, maintaining sustainability through ongoing and additional funding, and discussion and appraisal of the services provided at the centers by the universities, religious organizations, the Centers for Disease Control and Prevention, and the Department of Health and Human Services. Putting the model to use, we use 3 steps. Step 1 is the community assessment using the inquiry group methodology. There's 3 parts to this. First, the nurse must determine the hopes and dreams for well-being of the community in question. And then a definition must be made that the healthcare providers are experts in providing healthcare and in this model. And then a definition of the participant as an expert in his or her own self-care. Step 2 asks the question, how can we be helpful to you? By asking this question, healthcare providers then listen to the participant stories of health and well-being, and then in step 3, they try to recognize and respond to the community's calls for nursing. I'm going to read a practice exemplar from our book. As part of a community assessment, the inquiry group methodology assessment was used to determine the hopes and dreams for well-being of a community member in rural Haiti. Community members were gathered together at a primary school, and introductions were made using a language facilitator. The assertions were discussed, and the 3 facilitators were experts in the method and in nursing, but that each participant was an expert in his or her own self-care and the care of the family and community. The following question was asked: how can we be helpful to you? One man responded with a story of caring for his wife who was in a prolonged labor. He described how he carried her down from the mountain, her back against his back, and hired a motorbike to take her to the closest hospital, which was 45 minutes away. His call for nursing was heard loud and clear. We need a hospital so that our families don't have to suffer so much. For the class discussion, I would like everyone to think about how the community nursing practice model could be used in rural North Dakota. How would you identify your community of interest? What might be some responses to the question, how can we be helpful to you? And then describe how nurses can respond to the community's call for nursing. Thank you for listening to my presentation on the community nursing practice model. I'm sorry that I could not be there with you all today. Please feel free to email me with any questions or comments. Thank you. Bye-bye.